Hello, my name is Shelley. I'm a nurse navigator at Maury Regional Medical Center. I will be a part of your healthcare team.
Hi, I'm Megan. I'm a nurse navigator also. Today we're going to be going over information about your total hip and total knee replacement.
Thank you for choosing Maury Regional.
You and your doctor have decided that you will have a new hip or knee. Your new hip or knee replacement should allow you to move more freely and with more comfort than you do now. But that's after you heal and if you do your physical therapy exercises as directed. The information that we're going to present in this packet is going to help you know what to do before surgery and what to expect after surgery to ensure that you get the greatest benefit from your new hip or knee. Doing the home exercise program and the physical therapy will make a big difference in your healing process and in your recovery. So before surgery, we're going to talk about things that you need to go ahead and prepare. Make your ice packs, purchase ice packs, buy groceries, meal preparation, having transportation set up for the hospital, and your physical therapy appointments. The important thing is ask for help from your support system, whether that's your friends, your family, your neighbors, your siblings. Incorporate all those people that may be able to provide you assistance after surgery because you will need their help during this recovery period.
So your team here at Maury Regional Medical Center, that includes the doctors, the nurses, your surgeons through TOA. This is going to be your anesthesiologist. You have a very highly skilled team that will be preparing for your care. Your nurses at the bedside, and we are here and available as nurse navigators to help answer any questions that you have. Our program has received a lot of recognition and a lot of awards that we are very proud of. And also we are an advanced certified program through Joint Commission, and we strive to have very good outcomes. So there are a lot of places that offer hip and knee replacements, but our concern is that you have that done, but then again, that you don't get post-operative complications, that you do well going forward because you've made this decision to have a new hip or a new knee so that you will have quality of life in the future. They don't do anything to change yesterday or today, but what you want to do is become less and less debilitated in your future, and we share that goal with you. So let's talk about your total knee, total hip replacement. So when we start out in life, we have all the cartilage we're ever going to need, right? But over time, we wear that cartilage down. So I want to show you a little bit with this model how that works. So a knee basically has to just go back and forth and back and forth and back and forth, take our weight, and if we're running, that type of thing. And we wear this cartilage down. This is the piece that you really need. However, your surgeon has to do all of the other work in order to have a place for your new cartilage. They'll put your new cartilage in, and then the knee bends after you do the repetitive exercises to get it to bend. After you get the leg straight, it's more important that you get the leg straight than that you do get it to bend in the beginning. So your therapist will be working on this with you, and you will be preparing before surgery because muscles walk bones, and we will talk about that. That's why you will be doing your pre-exercises. So a knee does not have to do quite as much as a hip. A hip has to do more. A hip is a ball and a socket. And for our hip, we do have to do a whole lot more movement with that. So with a hip being a ball and a socket, when it's not touching, you have pain that radiates maybe in some other areas. You have pain right here in the bend of your leg, if you can see that. You have pain maybe that radiates to your back. And sometimes people will talk a lot about knee pain, but what they really need is a hip replacement. So once your surgeon does your total hip replacement, it works because it is a ball and a socket. Unlike the knee, that will take longer to recover, more physical therapy exercises that need to get that joint replacement to work. The hip is a ball and a socket. Now you have to allow all of the healing, and you will have pain. You will have the surgical pain, but maybe not as much pain as you had prior because you've been dealing with the hip that's not working, that's not touching, and that's not moving the way that you need to. But after your total hip replacement, that will come. Both of these surgeries are not pain-free. You will have pain after your total joint replacement, and we're going to talk about that. These are mechanical devices. They're never going to be like a natural hip or knee, but you will get back about 80%, maybe a little more, of what you remember a natural hip and knee being once you do your exercises.
In your total joint blue bag that you received at the pre-surgical testing appointment, you will find this booklet, Preparing for Your Joint Replacement. This is meant to be a workbook for you to actively go through with your support team, and they can work with you to go through the step-by-step processes. When you open up the book, on the first couple of pages, you will see the introduction, just as we've reviewed with you. Then you will get to the section that talks about what for you to do in the weeks leading up to surgery. It will help you prepare. It will talk to you about appointments that you need to make. You will notice on one of the first things that you see in the weeks leading up to surgery is that you will see the need to attend your pre-surgical testing appointment. Once you've completed this appointment, you will be able to place a check marks in the box beside pre-surgical testing appointment. Next to that, you will see attend the total joint class. This video that you are watching online will serve as your education for the total joint class. At the completion of this video, you will be able to place a check mark in the box beside that as well. We do recommend that if you do not have someone watching the education videos with you that's going to be there with you after surgery, that you do go over the information in this booklet with them. That will help you feel better prepared for surgery, and that also gives an extra set of eyes and ears to help know what to expect and help know how to prepare, how they can assist you after surgery. In this portion, we're going to discuss the weeks leading up to surgery. We've discussed completing your pre-surgical testing, attending the total joint class. We will also discuss about alerting your dentist about any upcoming procedure, making plans with your support team, completing your daily at-home exercises, preparing your home for your return from surgery, and enrolling in Maury Regional's Health Patient Portal.
So a little bit about your home exercises. You see those exercises, and they are very important to your recovery. They are very important to your ability to get up and move after surgery, because muscles walk bones. So with your total hip or total knee, it's the muscles around that you're strengthening. The exercise themselves do not do a thing for your hip or knee. They're bone on bone, and you need a replacement. When you're at home, you don't have to get in the floor or have any special equipment, but you will need to be able to get your leg out straight. So if you're sitting in the bed in a recliner, or you have two chairs, as I demonstrate here, you want to get your surgical leg straight. It's important to bend your other leg in order to take pressure off of your lower back. So on the quad set, you're simply, and this is your quad muscle, your thigh muscle, you're bringing your toes back towards you. You're flexing that foot, and you'll hold it 5 or 10 seconds. You could be watching television or talking with someone, even on your cell phone. So you're gonna hold it, 1, 2, 3, 4, 5, relax. Tighten back up. You feel it right here. 1, 2, 3, 4, 5, relax. The second one is the straight leg raise. The further back you can go in your bed or chair, the higher your leg is going to go. But basically what you want to do is you just want to lift it up and put it down, and lift it up and put it down, and you will feel it in your thigh muscle. So if you can only do 5 of these to begin with, what you want to do is work up to where you can do 10 to 15 of these in a row. Sometimes the therapist will say, once a day is good, twice a day is good, but you'll want to practice this because you want these muscles to be strong after surgery. The heel slide can be a little difficult for the total knee because you're bone on bone, but just bring it back as far as you can and then push it back out. With this next exercise, you can do it side lying or kind of roll over in the bed. It's a little more difficult, obviously, if you're sitting in a chair, but you can take your surgical leg, bend your other leg, and you just lift it up again, put it down. You can see how the picture goes. Or the same exercise can be done standing. You can hold to the counter or hold to the back of the chair, and you're going to take your leg out and bring it back in, and take your leg out and bring it back in. And I've heard the therapist tell patients, you want to be sure that you're not turning your foot in, and that may be more comfortable, but what you want to do is keep your toes straight and take it out, bring it back in. You can work both sides of your body, but really the side that you need surgery on, is weaker than you think it is. And you are using the other side of your body because you do need a new hip or knee, and it's your stronger side. The last exercise that you will practice that we share with Maury Regional, you've also possibly received exercises from TOA, but we like for you to try to do this one. It's called dips in the chair. The hardest thing you'll have after your total joint replacement is trying to get up and down. You'll need a lot of upper body strength to walk with your walker and also to get up and down out of the chair. So this one, you just dip down, push yourself up, back down, push yourself up, and you're getting these arms ready for surgery.
Your total hip or knee replacement is an outpatient procedure. The majority of these cases do go home from the hospital the same day as their surgery. Approximately 60% of those cases do go home same day. There are a few particular situations where care in a skilled facility may be necessary, but you will need to discuss this with your healthcare team prior to surgery. Many insurance companies will deny a stay in a skilled nursing facility following surgery. We want to help you prepare for your discharge and not surprise you. Since the majority of our patients do return home the day of their surgery, and those typically the following day, you will need to have your home prepared for your return, whenever that may be. So when you return to your home this afternoon, or if you're at home currently, take a look around at the way things are currently set up within your home. Take a look around and say, am I going to be able to get a walker through this walkway? Am I going to be able to navigate safely to the bathroom, or are there throw rugs in the way that need to be put up in a closet until after surgery? Do you have any lamp cords or extension cords that extend into a pathway that you're going to be needing to navigate after surgery? All of these things can create fall risk, and we want you to go ahead and look around your home now and prepare these for your return. Go ahead, if you are going to be at home by yourself in the days following surgery, you may want to lower items to a lower shelf so that you're more able to reach them. Also think about meal preparation. Are you the primary cook in your house? Do you live alone? Will it be best for you to go ahead and prepare meals and freeze them? That can include something as simple as peanut butter and jelly sandwiches in Ziploc bags placed in the freezer in preparation for your return home. Also, be thinking of what entrance do you need to enter into your home when you return from surgery. Now is a great time to be thinking about that. If you have enough time before surgery and you'll need a ramp built, you can contact family, friends, neighbor, or support people to help with that. Look at the front of your home or the back of your home, or if you live in an apartment, be thinking about how many stairs that you're going to have to climb in order to enter your living quarters. Also, if you have stairs within your home, how many stairs do you have? Is it going to be safer for you to sleep on the main level? The physical therapist at the hospital, they will want to practice going up and down stairs with you before you leave the hospital. So knowing these things ahead of time and knowing which way you're going to enter into your home will be very helpful. Go ahead and prepare your ice packs as well. We're going to talk a lot today about ice and its role in your care, its role in inflammation, in pain control. So we do want you to go ahead and have those ice packs prepared and ready. You can do this by purchasing ice packs at any of the local stores. You can also quickly make ice packs as well. You can purchase blue Dawn dish detergent and just gallon Ziploc bags. You can take about 2 cups of the blue Dawn dish detergent. It has to be blue, it has to be Dawn. We don't know why, but you do pour 2 cups into the gallon Ziploc bag. Don't add water, no other ingredients are necessary. You can zip it up, lay it flat, and place that in the freezer. We also recommend that you place night lights around your home. We do expect that you will be getting up during the nighttime to move around, reposition to help with pain control, getting up and to use the restroom. If you have pets in your home, you may want to be thinking about when you return home, do you need to have them crated, or should it be best for like a family member or neighbor to care for them in the next day? They do love you and they probably will want to jump up on you, so just keep in mind that you've just had surgery. It may be best to arrange for someone to take care of your pets while you recover, or at least assist you in your home. You will need transportation to the hospital and from the hospital. You'll also need transportation if you're planning to do outpatient physical therapy. That typically is 3 times a week. Go ahead and secure your transportation plans now. It's a lot easier to have that scheduled out now ahead of time than it is to wait the day before surgery and try to rush and get all of that information together. As part of the nurse navigation role, we will be helping you to prepare some equipment in your home and also what type of therapy you will be receiving after discharge. As part of this pre-procedural phone call that we will go over with you prior to surgery, we will discuss the equipment needed, which will be rolling walker and bedside commode for some patients. With the rolling walker, this is typically covered by insurance as long as you have not had one covered through your insurance within the last 5 years. If you are borrowing a walker from someone, please make sure that it has the 2 wheels on the front and no wheels on the back, as this is the safest option for you after your surgery. Also, if you are borrowing a walker from someone, please make sure that it hits you about right here at your wrist. This would be an appropriate height walker for me. If it is too tall or too short, there are ways to lower it and raise it up by pressing the buttons at the bottom towards the wheel. When you first stand up after surgery with physical therapy, it's going to be important for you to balance your weight out on both of your feet. As Shelly mentioned earlier, your body is currently experiencing pain when you put weight on both of your legs, most likely. So you have been shifting your weight to the other side. Your brain is naturally doing this. So now when you get up after surgery, you are going to have to remind your brain to kind of rewire. Say, yes, this new hip or knee replacement will hold me up. It will support me, and I'm going to be using it now as I move forward. So just in those first moments when you get up from physical therapy, even your weight out on your feet and stand there. Now, when you get ready to ambulate and walk with physical therapy, you may have to adjust your legs again, but this putting weight on both legs helps your brain to recognize this new hip or knee replacement as part of your body that is now functioning. When you begin to ambulate with the rolling walker, you will notice that my speed is much slower than normal. This will be safe, but you may also want to think about if you already have incontinence issues or possibly may have incontinence issues after surgery, to go ahead and prepare with briefs or little pads that you can put in your underwear. That way, if you get to the bathroom and you have already had an incontinent episode, you don't have to change all of your clothes. That's just a tip. Another tip is we prefer that you have something on the front of your walker. There are things that you can purchase at any of the stores, typically that sell like little baskets that go over, but you can also just place any type of bag here. The important thing is that you remain hands-free. Let's say I have something in my hand and I want to carry it around. When we use our arms, like Shelly showed us that you will be using after surgery, when you place your weight down, it is very easily to become off balance, because when you hold things in your hand, you're just naturally off balance. We do not want you to fall. So for safety measures, we would like for you to use the basket. Please place anything in there that you need to carry with you. That may include your cell phone, the remote, your ice packs, drinks, or snacks. So the same thing applies with the reacher. You may want to carry this and keep it handy within your walker, but you will want to remain hands-free, so it can be situated like this. This could come in handy if you're walking and possibly drop something. You're not going to be able to reach down, and certainly we want you to remain safe. So a reacher can really come in handy for you at these times. It can be stored just like this. The next piece of equipment that we're going to discuss is the bedside commode. The purpose of this is actually not intended for you to put it beside your bed, but rather over your existing toilet. Shelly's going to demonstrate for us how to remove the pot that comes with it. You will notice you can just sit that over to the side. She's also going to show you how to remove the back handle. This comes off easily by pressing the buttons on the back of the bedside commode and lifting up. This now allows you to slide it over your existing toilet. This serves 2 purposes. As we've discussed a couple times, you will be using your upper body strength to lower your body and also to push up whenever you're getting off the commode as well. If you are a total knee replacement, after surgery, your knee will not be at 90 degrees. If you are currently sitting down with your feet both planted on the floor, your knee is at a 90-degree angle. As Shelly is showing you, after surgery, you will not be at a 90-degree angle if you're a total knee replacement. One tip and trick is that you may want to have a stool or something to prop your leg up on after you have a knee replacement, because your leg can get really heavy sitting there. Also, Shelly is going to show us how to fold this up so that it will be easier to transport from the hospital to your car. It folds up just as such, really easy like this. The rolling walker does fold up as well. The same rules with the bedside commode apply. Typically, this is something that is covered by insurance as long as you have not had one purchased through insurance within the last 5 years. If you do contact your insurance to see if this is a covered benefit, they will ask you if you have a physician's order for this, and yes, you will have a physician's order for this. The only exception for this is if you're having an anterior hip replacement. Some of those patients will not receive a bedside commode if you do not have hip precautions. We will go into a little bit further about that on a case-by-case basis when we discuss that with you on your nurse navigation phone call. There are a few additional pieces of recommended equipment, and these would be for purchase as they are not covered by your insurance. The first thing that we're going to discuss is the shower chair. This is often patients find that is helpful. However, it is not covered by your insurance. You can look at local DME companies, or there are some online options for that you can speak with your nurse navigator about as well. Some of the other items we've discussed are the reacher. There's also the shoe horn, which can help assist you get your shoes on, as lowering your body after surgery may be more difficult, and this may be a task that you find difficult after surgery. A shoe horn can certainly help with that. The next item that we are going to discuss is the long-handled sponge. This can come in handy for bathing, and as Shelly is demonstrating, it does have the long handle. One of the next items that we're going to review is the dressing stick. This can be particularly helpful for people who are trying to pull their pants up but have difficulty reaching down, as most of you will find it difficult to reach over or bend over, and some of you may have limitations with bending. So as you're using the dressing stick, you can use it to pull your pants up, and it comes very much in handy. The next item is the sock donner. This can come in handy when you are trying to put on your socks and you don't have anyone to assist you. You can take this and spread the sock over it, and then you will use the strings to pull this up onto your body, and then your sock will be on. Now, several pieces of these equipment, if you purchase them and you would like assistance with use, your physical therapist can help you with them as well. So another note to add is that you can buy these items sometimes in groups or packages online, or they are also available for purchase at Maury Regional's gift shop. Before surgery, please speak with your primary care physician to see if you are a good candidate for surgery. For surgeries during September through March, we encourage a flu shot prior to surgery. If you're over the age of 65, you should also speak with your primary care physician about the consideration of a pneumonia vaccine. This does not prevent from post-operative pneumonia, but rather a different type of pneumonia. Please discuss with your primary care physician. Maury Regional Health has an online patient portal. If you would like to sign up for this patient portal, we recommend that you go to mauryregional.com/portal. If you need any assistance getting set up or accessing the patient portal, for assistance, please contact 1-877-621-8014. The week of your surgery, you will need to schedule an appointment with your primary care physician, confirm arrangements with your support person or support persons, make sure you stay hydrated, take care of any additional health needs, and notify your surgeon if you feel sick in any way. Before surgery, you will need to confirm with your support person or support persons who will be driving you to the hospital and who will be picking you up from the hospital after discharge. You will not be allowed to drive until you are cleared by your surgeon, and you will not be permitted to leave the hospital on your own after surgery. Please secure a driver ahead of time. Please make sure you also secure someone to stay with you for the first 24 to 48 hours after surgery. During that time period, it's going to be important that you do have someone there with you, whether it's in your home or whether you're staying in their home during that recovery period. Safety is our first priority for you. You will need someone to make sure that you're being safe around the house, and most patients also need assistance with medication management.
So as we have said, we want you to get your new hip, we want you to get your new knee, but we do not want you to get those complications after surgery. Hydration is very important for multiple reasons. We do not want you to get the post-operative pneumonia, blood clots, constipation, all of these things that could come. So the hydration helps with preventing blood clots. You're also going to feel better, and it'll be very important to your recovery. So we just have some props here to show you at home. You will need to stay hydrated, have something to drink beside you. This shows you like every hour. These are things you could order or buy around town, but basically just a reminder that throughout the day you need to be drinking. You can start 3 days prior to your surgery, and that is to start with liquid IV. There are other name brands. It doesn't necessarily have to be this one, but these little packets, you pour them into water and drink these, and these do more to hydrate you than the sports drinks and other things. These will help keep your electrolytes going well too before and after surgery. There are some contraindications as far as if you have severe kidney disease, but otherwise for the majority of our patients, it will be important that 3 days prior to surgery you are drinking your liquid IV. Then you can also drink it after surgery. You're not going to have a big appetite, but it'll be important to stay hydrated and that you are at least drinking your calories. So as part of that hydration, the protein drinks, again, you can get any brand, any flavor that you like. This brand has 30 grams of protein. So we will want you to increase your protein for healing, increase your protein for energy, to do the exercises, to get up after surgery. You will be a little weaker, and it'll be important that you are drinking protein or eating, but many times you will lose your appetite, so prepare for that. So just like preparing by hydrating, popsicles, jello, broth, anything that's going to turn to liquid, there are some other things you need to be starting before surgery. You need to stop any over-the-counter medications. You need to stop fish oil, Lavazza. You need to stop those 14 days before, as well as CBD 14 days before, because these increase your risk of bleeding after surgery. Many over-the-counter medications and herbal things, such as biotin, skin, hair, and nails, the fish oil, again, like I said, there are things like krill oil. All of these supplemental things that you are doing could contribute to bleeding after. So just stop those supplemental things prior to your surgery. Any ibuprofen, Aleve, things like this increase bleeding. In anesthesiology, the anesthesia nurses will speak with you about that as well, but it will be important. You need to stop marijuana 7 days prior to surgery, because again, all of these things will cause increased bleeding after surgery, which would require multiple dressing changes possibly, and that will increase your risk of infection. So we need you to be thinking about this prior to your surgery.
The day before your surgery, you're going to follow your preoperative instructions. You will receive a call and confirm your arrival time for your date of surgery and complete your CHG skin prep. The day before your surgery, you're going to make sure that you increase your fluids. This includes drinking water and using items such as popsicles, broth, and jello. Please avoid caffeine and alcohol. The night before your surgery, do not eat or drink anything after 12 a.m. midnight. This means no coffee, water, gum, candy, or mints. Do not use tobacco for 24 hours before your surgery, and this includes no smoking, no dipping, chewing, or vaping. As far as your medications, please follow your instructions from your pre-surgical testing or the anesthesia nurse who contacted you regarding which medications to take and when to take them. Prepare these items to bring with you the day of surgery. If you've had any updates or changes to your medication list, if you use a CPAP or a BiPAP machine, please bring it with you to the hospital, even if you're not planning on staying overnight. The hospital will provide distilled water. You just need to bring your machine. You also can bring any grooming items that you would like, such as shampoo, toothbrush, toothpaste, deodorant. Everyone will need to wear loose-fitting clothes. This could be shorts or wide-leg pants. You are also able to wear any kind of shirt during the day. Please bring an extra pair of shorts or pants. You will want to make sure that any of the shorts or pants that you bring have an elastic type waistband. You won't want to have any buttons, zippers, belts, or any extra things on your pants. Please, no nail polish. This includes toenail polish and nail polish. Again, no toenail polish or nail polish can be taken into the OR. Also, no acrylic nails. Please make arrangements to have these removed. You also will be given non-slip socks to wear while you're in the hospital. When considering which shoes to bring with you to the hospital, please make sure that you wear a shoe that is secured around the heel of your foot. This means no slides, house shoes, flip-flops, or anything without a back, as those can increase your risk for falls. Additionally, please leave valuables at home. This exception to this would be if you have a copay on any of your prescription medications, you will want to bring that with you to the hospital. The reason for this is we do recommend that our patients have their medications filled by Maury Regional's outpatient pharmacy prior to leaving the hospital. We recommend that you use Maury Regional's outpatient pharmacy before you leave the hospital because we know that you are being discharged with the medications that your doctor has prescribed, and you will not have to be searching around different pharmacies to find the medications that you need. Everyone's favorite question, what time do I need to get there for my surgery? We will not know your surgery time until 2 p.m. the day prior to your surgery. If you are having surgery on a Monday, you will receive a call around 2 o'clock on Friday to notify you of your surgery time. Otherwise, you can look for a call from Maury Regional around 2 p.m. the day before your surgery. Preventing surgical site infections is a joint effort between you and your healthcare team. As part of this, our infection prevention with you begins the day before your surgery. As Shelley will show you, included in the blue bag that you received at PST, you should be able to locate 2 packages of the orange CHG wipes. You will be using both of these packets on the day before your surgery. At this time, please get out the piece of paper that shows you the step-by-step instructions for the CHG wipes. You would have received this as an individual piece of paper at your pre-surgical testing appointment. Once you have located this piece of paper, please get out the 2 packages of CHG wipes and place them in front of you. You can actually place these in your bathroom with the piece of paper tucked around them. That way it will be ready to go the day prior to your surgery. Please remember, these wipes cannot be heated. Do not leave them in your car. Do not heat them in any kind of warmer. The instructions for use for the CHG wipes are as follows. The day prior to your surgery, you're going to get up that morning and you will shower, wash off, and dry off as normal. Even if you don't shower normally in the mornings, the day prior to your surgery, you will need to shower. After you have washed off and dried off as normal, do not put on any kind of lotions, no creams, no powders, no perfumes. Nothing goes on your skin. You will get out your first package of the orange CHG wipes, open your package up, and you will see listed out on your printout that you are going to use the first wipe on your neck and your chest area. Please follow the step-by-step instructions that are listed on the left side of your handout, as well as the visual representation of the man with numbers over his body. After you're done with wipe number 1, please throw that in the trash can. You will not want to flush those. Then you will get out wipe number 2. Wipe number 2 is going to tell you to use both arms, front and back, all the way from your shoulder to your fingertips and underneath your arms as well. Wipe number 3 is going to be in your lower abdominal and perineal area. Please do not get this in your private area as it will hurt and it will burn. After you finish with wipe number 3, you will get out wipe number 4. Wipe number 4 will be used for both of your legs, both front and back, including your feet as well. You're to wipe each area as described on the paper. After you finish with wipe number 4, you will proceed on to wipe number 5. Wipe number 5 will be used for the back, the upper part of your back. If you have any difficulty reaching this upper or lower area of your back, please obtain something from your home that has a long handle, such as what Shelley is describing. It does not have to be a long-handled sponge, just anything that you have in your home. You can then use a chip clip or some kind of item to secure this, and then you're able to reach the top and your lower back. You've now completed wipe 5, and you will go to wipe number 6. Wipe number 6 does cover your lower back area and buttocks. Please follow the directions as listed on your instruction sheet. When you have finished with wipe number 6, it's very important that you allow this ointment to dry. As it dries on your skin, you may feel it kind of tacky or sticky. From the time that this ointment is wet, from the time that it dries, is called the kill time. And this is important for the microorganisms on your skin to be killed. These microorganisms or bacteria don't usually cause this issue on a normal day, but prior to surgery, we want to ensure that your entire body has been cleaned as instructed. After you've allowed this to completely air dry, then you will be able to put on your normal clothes and continue your day as normal. After you have fully finished with your wipes and they have completely air dried, you are allowed to put deodorant under your arms only. That is the only exception to any ointments or creams being applied below your chin. After your morning CHG wipes, then you will use your second package of the orange CHG wipes the night before your surgery. This will make your second package for the day prior to your surgery. As the same process that you did in the morning, you will go step by step, wipe by wipe, listed out as you have on your instructions. Please allow these wipes to air dry completely again. Once you have air dried, then you will put on clean pajamas. Make sure you have clean sheets on your bed. If anybody shares a bed with you, they will need to have on clean pajamas as well, and no pets in the bed the night before surgery, all as part of our infection prevention process. Infection prevention is critical. Do not get a scratch or a bump on your hip or knee that you're going to be having surgery on. If you do, please contact your surgeon immediately. Do not shave your legs or surgical area for 2 days before surgery. Do not shave your face the morning of surgery. Your last opportunity to shave your face will be the morning, the day before surgery, and before you shower. Do not use any powder or lotion on your body after your shower or after using your CHG wipes. Do not shower the morning of your surgery before coming to the hospital. Do not allow any pets to sleep in your bed the night before surgery. Wear clean pajamas to bed the night before surgery, and if anyone shares a bed with you, they need to wear clean pajamas as well. The day of your surgery, do not shower the morning of your surgery. Get up, get dressed, and come to the hospital. Wear loose, comfortable clothing. Drink your Gatorade on the way to the hospital unless directed to hold by your healthcare team. Wear loose, comfortable clothing to the hospital the morning of your surgery. You will be given non-slip socks to wear while in the hospital. Please remember to bring your shoes that have the backs on them. Do not wear slides or flip-flops.
On the way to the hospital, you will drink your Gatorade unless you've been instructed by your healthcare team, pre-surgical testing, or your surgeon not to drink your Gatorade. Gatorade has many benefits. Gatorade is a carb load. So for example, you've had nothing to eat or drink after midnight. What Gatorade's going to do is trick the body so that it doesn't go into that starvation mode. So now that patients can drink Gatorade prior to surgery, when you wake up from surgery, you're going to feel so much better. And it's very hard on a diabetic to go into that starvation mode. So even diabetics drink this unless otherwise instructed.
During and after surgery, arrive at same-day surgery, CHG wipes protocol. They will be provided to you at the hospital. Nasal sanitizer to reduce the risk of infection, post-anesthesia care, pain management, discharge planning, preventing complications, rehabilitation, and additional resources. All total joint replacements take place at Maury Regional Medical Center. Please refer to your guide for instructions where to go when you get to the hospital. When you arrive to same-day surgery, you're going to be asked to remove dentures, hearing aids, hairpins, wigs, jewelry and all piercings, glasses, contact lenses, nail polish. This includes fingernail polish and toenail polish, no acrylics. They will be asking you to remove all underwear, and the same-day surgery nurses will provide you with a third packet of CHG wipes to use.
The morning of surgery is an effort to prevent infection. You will have your nasal passages swabbed with Nosin. Again, this is to prevent any infection and to reduce your risk of MRSA or staph infection post-surgery. After surgery, you will spend at least 1 hour in the recovery room. So you've done the things for prep before your surgery, and then while you're in the recovery room after your surgery, the nurses will be going around checking your vital signs. You may have oxygen on. That may be in the form of an oxygen mask or possibly in your nose with a nasal cannula. So all of these things will be your waking up phase, and your recovery team will be helping you and talking with you. Your family at this time will be in the waiting area, and then once you are reunited, either you are going back to same day where you started, and from there you will be going home after you work with physical therapy, or if your plans are to stay overnight, you will be going to the 6th floor in our hospital, and the staff will let your family know which room you will be in. Everyone who has a total hip or total knee replacement at Maury Regional after surgery will be evaluated for once the numbing wears off and you're able to get up and walk. You will walk with your physical therapy team. They're going to get you out of bed and they're going to talk with you about managing steps at home and how to get around. You've covered a lot of that in your preparation work, but this is when you're actually going to know, I'm able to get up, I'm able to walk, I'm able to go up and down steps. So you will talk with your physical therapy team about any concerns you have with getting into your home, but they are going to help you with all of these things. So after surgery, your discharge planning, we've already been speaking with you before surgery and in your information that you need to have transportation home, you need to have a driver, you will need to continue your physical therapy exercises, and we have spoken with you about your outpatient physical therapy or possible home health. We've talked with you about those discharge plans. If any of those have changed, it will be your discharge planning team, myself and Megan, and it will be the post-acute care providers, but we will be helping you get all of these things arranged. Driving may begin again when your surgeon gives you permission. Do not drive before your surgeon releases you to drive. If staying overnight, the next morning they will get you up around 5 a.m. and that can be a little shocking, but they will get you up, get you over to a chair. Your surgeon will be coming to visit you. You will not be getting up by yourself. Your family can stay with you overnight if they would like, but that's not necessary. They do not have to stay with you. Again, physical therapy will work with you one more time before going home. They will practice going up and down steps, things now that you're ready to do to discharge home. If you're going home same day, remember again, you have done these things after surgery prior to your leaving the hospital. If staying overnight and your family does decide that they would like to stay with you, we can provide them with a chair bed that will make out to a bed. We can provide blankets and things of this nature for comfort, a pillow. However, food is not available. Meals are not provided to family, but we will try to make your family member as comfortable as possible. They may want to bring snacks, and that's fine. And we also have a cafeteria and a coffee shop at Maury Regional. And in our gift shop, there are also snacks available. So now let's talk about pain management. A hip and knee replacement, they are not pain-free. There is a reason why we want to talk about managing pain. So you will have pain, and we've discussed with you prior to surgery, tolerable pain. You're in pain now prior to surgery. And so what we want you to be is functional. You still get up, you get dressed, you're going to do your physical therapy exercises. The surgical pain, so may make the pain a little worse before you get better, but you will get better. Before surgery, you're only deteriorating. And so every day it's getting a little worse. But after surgery, it will be better. On that scale from 0 to 10, that is where we are going to talk with you about what is your pain level. That 3 to 5 would be expected. We're expecting you to say you're between a 3 and a 5, even with pain medication. Because if you are completely pain-free, you can't feel anything, and these total hip and knees, they're mechanical devices, they're not ready, and we don't want you to fall or have injury. So if your pain level is a 6, 7, 8, 9, 10, we're going to discuss some of those things. That's the point that you would need your pain medication. You're going to need your pain controlled in order to get up and move. You will need to take your pain medication about 30 minutes. It takes about 30 to 45 minutes for it to dissolve and get out into your bloodstream. So your pain medication that you take, you're going to do that before activity, before your shower, before you go to physical therapy, and things like that. So you'll want to be preparing for that. And we're going to talk now about multiple ways that you can control this pain. Yes, you'll be given a narcotic. Yes, you can have that filled at Maury Regional before you go home. There are going to maybe be some over-the-counter medications that they may recommend that you take, but you're hurting for multiple reasons. We talked about that surgical pain. Every day you're healing, and that is going to go away. All of this that you're dealing with right after surgery is temporary. Things like ice can help with the inflammation. So you have the surgical pain, but then you also have inflammation. And that is where your maybe ibuprofen, meloxicam, ice, elevating it, your leg, even above your heart some, depending on how high you can get it after a hip. But all of these things are going to help manage that pain. If you could control the swelling, you're going to control a lot of the pain. You know now, when it swells more, it's more painful. When you've been up on it a lot throughout the day, When that happens, it hurts more at night. That's why we say we want you to get up and move. We want you to get up and walk around, but we don't want you up greater than 15 minutes at a time. We want you to do rest, activity, rest, activity, rest, activity. And then light a candle. Do a devotion, play your favorite music, whatever is going to help you to be calm in your environment. I know after a surgery, it's really nice for everybody to come visit you, call you, but you are dealing with a lot. And so you need a calm, quiet environment, and you need comfort items. Please review the comfort menu and think about these things after surgery. In your total joint bag, and we've referred to it multiple times, you received an incentive spirometer. This is in your bag because we want you to get it out and get it set up prior to your surgery. Put it on that table beside your chair as you're preparing to come in for surgery. But your incentive spirometer comes in two parts. So you're going to slide your mouthpiece on. You're going to hold it in your hand like this, and you are going to suck in. What you want to do is blow all of your air out to empty your lungs, and then you are breathing in to fill your lungs up. As you do, this little green circle should float around this smiley face. It's more important that you can get the green circle to float around the smiley face than even how high the middle goes. Here's an example. So I'm going to blow all of my air out, put my mouthpiece in, and then I'm going to suck and not blow. Once the green circle has dropped to the bottom, all the suction is gone. So just stop when it falls, and then you will take your next breath. You'll blow your air out. You'll use your incentive spirometer. You're going to be taking 6 to 10 good deep breaths every hour that you're awake. Some people say if you'll watch commercials if you're watching television, every time a commercial comes on, pick it up, do your deep breathing and coughing. But remember to do this. You're going to be kind of groggy and dozing in and out throughout the day. And when you've dozed off, when you wake up, when you've been sleeping, you're doing that really shallow breathing. So pick it up, start the cycle again, and every hour that you're awake, do your deep breathing and coughing. Good mouth care also helps prevent post-operative pneumonia. And then we want you, again, to get up, to walk around, not be up greater than 15 minutes at a time, but do be up and active to prevent that pneumonia, constipation, blood clots, all the things we're referring to here. And keep the head of your bed elevated just a little. You don't want to go home and lie down completely flat. If your medications and you're feeling like you are sleeping all the time or a little too sedated, please reach out to your nurse navigator, your healthcare team. Those are a higher risk of getting that pneumonia. If you're a smoker, remember to stop 24 hours prior to your surgery. You want to reduce all of your risk that it would be there for that post-operative pneumonia. We talk about infections. We've talked a lot about that. We've said it's crucial, it's critical that you do not get your new hip or knee infected. This whole course of care, how your recovery will go, and you recover in terms of weeks and months, not days. So we don't want you to get any of these complications. You'll want to do very good oral care. We've given you a mouth kit in your total joint bag. These are suggested items, but you can use any name brand that you prefer. But you will want to use mouthwash, chapstick. You can brush your teeth, 2 to 3 times a day. We just want to be sure that no bacteria or anything that you have in your mouth can travel to your new hip or knee. You'll want to let your dentist know that you've had a new hip or knee, and you'll wait 6 months prior to seeing your dentist. You can have any dental work done prior to surgery, but after surgery, you will need to wait 6 months. Preventing a urinary tract infection. Hydration, we've spoken a lot about it. It helps you to feel better. It prevents those blood clots, and it also is going to help prevent a urinary tract infection. Women need to wipe appropriately from front to back. If you're having any signs of a urinary tract infection prior to surgery, or you know that you're prone to those, you need to check with your primary care physician prior. And if you're having any symptoms, please alert someone so that they know. Preventing the constipation. 3 days prior to surgery, we talked about you doing the liquid IV. We want you to do good mouth care. There's lots of things happening, increasing your protein. We also want you to start a stool softener, and that's going to help prevent constipation. The inactivity, the narcotics, you're not getting up and moving around as much, All of that is kind of the perfect storm for constipation. So a stool softener won't make you go, it will just make it soft when you do go. So please start your stool softener, and you can get it over the counter at any drugstore or grocery store that you do your shopping. Get your stool softener started 3 days prior. Preventing blood clots. Again, we've talked about walking around, staying hydrated. They're going to give you a blood thinner. Possibly that's an 81 milligram aspirin that you're going to take twice a day, once in the morning, once in the evening, and you'll do that for 30 days. Some of you are already on Eliquis. You're on different blood thinners. You will start those back. You've stopped those prior to surgery to decrease that risk of bleeding. It's important that we take our blood thinner and be sure that we do not develop that blood clot.
When you wake up from surgery, you will have one of these two bandages on your body. This here is called the Pico 7. You don't have to remember the name of it. This is a smart device, and this is the Aquasil dressing. Again, you don't have to remember the name of it. Both of these dressings, they work to pull any drainage that you may have on top of your incision to the top of the bandage. Doing this keeps the drainage away from your incision site and keeps it clean and dry as we would like. When you look down at these dressings, whichever one you have on your body, it is normal to see some drainage, possibly in the middle. That just means that these bandages are doing their job and they're pulling it to the top of the dressing. Both of these dressings are waterproof. That means you can use them in the shower. No tubs, no any other type of water, but shower is acceptable. Please make sure that the edges of your bandage stay tightly secured to your skin. This prevents any kind of bacteria from entering in and getting on top of your incision, which could potentially cause an infection. The goal for these bandages are for them to remain intact on your body until you follow up with your surgeon in between 2 and 3 weeks. With the Pico 7, you can see that it has an attachment. This is a battery pack. Again, the drainage is pulled to the top of the dressing, but it does not come down the tube into the battery pack. This is simply a battery pack. You will know that this device is working when it has a green flashing light. That's how you know that it is on. It is a smart device, and it will naturally work. Usually it will cut off by about day 7 or on day 7, or prior to that if it senses that you're not having any drainage. Once the green light comes off, you will be able to disconnect. The bandage will remain on your body, whether on your hip or your knee. You will be able to unscrew the device to separate it. This will remain intact on your body, hip or knee. This can be thrown in the trash after the device is cut off, as you will no longer need it. It does have 2 AA batteries inside if you would like to keep those. Otherwise, this can go in the trash. After you have disposed of the battery pack and you have this remaining on your body, you are able to trim part of this. Please do not trim it down next to the bandage where it joins the bandage, but a little up from it. When you're using the restroom and you have one of these bandages on, please be careful to pull your pants and your underwear away from your body and then down. And again, when you're going up, pull your pants or underwear away from your body and pull up, as these edges may become irritated or roll down. If the edges unstick from your skin, you will need to consult your healthcare professional to see if that needs to be changed. As previously mentioned, it may be possible for you to look down at your bandage that's on your body and see drainage on the bandage itself. So the question that we receive a lot is, how do I know if it's an appropriate amount of drainage or if this needs to be changed? You will see that we have 2 pictures to show you of the drainage. One is an acceptable level of drainage. In the acceptable level of drainage picture, you can see that the drainage remains in the middle portion of the bandage. There's another picture beside it over to the left, and you can see that in that picture, the drainage extends to the border of the dressing. Once drainage extends to the border of the dressing and begins to potentially come to the edge or leak out, that is when the bandage would need to be changed. If the bandage just becomes soiled where the drainage reaches the edge of the border, or if the edges begin to roll down, this will require a bandage change. There are instructions in your patient guidebook, step by step, of how to change the bandage. This can be done by your caregiver. First of all, you will want to make sure that they wash their hands and then follow the step-by-step procedure. If you have home health can also change the bandage as well. And if you do have to change the bandage, you will need to notify your surgeon's office by contacting TOA to let them know. A couple of items that you may want to put on your list to purchase before surgery is sterile 4x4s and normal saline. We do not anticipate that you will need to change your dressing at home. However, in the event that you did need to change it at home, it would be better for you to already be prepared with the sterile 4x4s and the normal saline. You can purchase these items at any drugstore or any shopping center. Again, the intended purposes of these bandages are for them to remain intact on your body until the follow-up appointment with your surgeon's office. Some surgeons may use staples, while others may use glue, Durabond, or stitches for your incision. If you have staples, your staples will be removed at your post-operative appointment.
So be assured, nothing about your new hip or new knee is a medical emergency. There are some reasons to reach out to your surgeon. So your body sees this new device as foreign. So your immune system is going to kind of be overreacting. That's where a lot of the swelling, pain, and then your body can even spike a temp after surgery. If that temp, you cannot break it within 24 hours, or your body temperature goes above 102.5, again, greater than 24 hours, you would want to reach out to your surgeon and let them know. The drainage, if you have excessive drainage outside those borders that Megan talked with you about, you would want to alert your surgeon. If you are having chest congestion, problems breathing, you would want to talk with your surgeon about that. Use your incentive spirometer. If you can't clear your lungs, you'll want to reach out to your healthcare team. There is no reason to go to the emergency room unless you're having a life-threatening situation. If you are having problems breathing, you think you're having a heart attack or a stroke, please dial 911. For everything else, you're going to contact your surgeon or healthcare team to address any issues that you are having. If you are having excessive pain, remember your ice, remember your comfort items. Keep a log of when you've taken your pain medication last. Be sure that you are managing that well, and if you have questions, please reach out to your healthcare team.
When you return home, you will need to go over and continue using the therapy exercises that were provided to you by the physical therapist at the hospital. Even on the days when you don't attend outpatient physical therapy or have home health come and visit your home, you will need to be doing the home exercise program provided to you at the hospital. Strengthening your muscles by lifting and extending when you're sitting or lying down. Make sure you're getting up and out of your chair and walking around about 10 to 15 minutes each hour. This will help you with pain control. This will also help prevent blood clots as well. We don't want you to be up for more than 15 minutes an hour at a time because that will increase your pain and swelling. Make sure you're alternating activity with rest, activity with rest. This will help you move forward in your recovery period. You will regain your strength and endurance by beginning to do your normal daily routine, but this will come gradually. This will not be leaps and bounds. This is a gradual progression. Don't do too much too soon. Physical therapy is important to your overall outcome. The goals for physical therapy will be to increase your range of motion, and your physical therapist will work with you on this. They will also work with you regarding increasing strength. Safety is important. Walk on level surfaces, use stairs, and use your assistive device. This includes your rolling walker or your cane if you have been approved to transition to a cane. You will also be provided patient education at your home health physical therapy or your outpatient physical therapy appointment. What to expect at outpatient physical therapy. You may experience moderate to severe pain, and it is recommended that you take pain medication about an hour prior to your therapy session, whether you are having home health therapy or outpatient therapy. This will help you be able to maximize your therapy session. Please make your therapy session the event of your day. This means please do not plan on attending any other appointments, grocery shopping, or any other task. Your outpatient therapy will be the event of your day. Please note, swelling can last for several months after surgery, but should gradually improve. Please use your ice and elevation to help with swelling. Please wear loose, comfortable clothing. For your total knee replacement, do not rest with a pillow under your knee. You should keep your knee straight when you are sitting or when you're laying in bed. You do not need to put a pillow under your knee. This keeps the knee bent. You want to keep your knee straight after surgery. Use your thigh muscle to straighten your knee. When your leg is resting, such as sitting or in the chair or laying in the bed, your knees should be straight. Your doctor may give you a knee immobilizer. Use it when you're walking to lessen your chance of a fall. Use ice to reduce swelling in your knee. And please know that rehab can last for 6 to 12 weeks after your surgery. Hip replacement. Hip replacements may have precautions. Your physical therapist will teach you what to do or not to do after your total hip replacement. Use ice to reduce swelling in your hip. And again, rehab can last for 6 to 12 weeks after surgery. Thank you again for choosing Maury Regional Health for your total joint replacement.
If you have any questions, Megan's card and my card, they are in your blue bag. My name is Shelly. Please reach out to us as part of your healthcare team and we will answer any questions that you have. Thank you for choosing Maury Regional Hospital for your hip or knee replacement.